Hi everyone, welcome to our webinar today. My name is Dr. Julie Huang. I'm a naturopathic doctor and owner and co-founder of Aurum Medicine and Wellness Clinic, and I'm super excited and grateful today to be able to introduce our dietitian at Aurum, Rebecca Minshall. So she's here today to tell you all about designing your diet for mental health. Rebecca is a holistically minded dietitian who believes that food is the cornerstone of well-being and that it's complementary to life. It should not be overwhelming or restrictive. So by using mindful eating approaches, Rebecca focuses on what works best for each individual that she works with, and she recognizes that we're all unique. After obtaining her undergraduate degree in applied human nutrition at the University of Guelph, Rebecca completed over 1,400 hours of clinical placements and obtained her master's degree in nutrition communication at Ryerson University in Toronto. She has experience treating a wide range of health conditions and chronic illnesses, including diabetes type 1 and 2, gestational diabetes as well, obesity, weight loss, hypertension, hypercholesterolemia, eating disorders, and mental health. In addition, Rebecca has training in nutritional psychology, cognitive behavioral therapy, and meditation. She is passionate about mental health and well-being and loves sharing her knowledge to help others feel healthier and happier. Beyond dietetics, Rebecca is also a singer, songwriter, and musician and avid reader, and she loves connecting with others and is always open to new experiences. So I wanted to introduce Rebecca to you today. We're super grateful that she's going to talk about this topic, and I know a lot of folks have asked a lot of questions about this type of topic in our previous webinars. So this is the last of a series of 4 webinars that Rebecca has put on, and they're all free and available on our website at AurumMedicine.ca and on our blog, AurumMedicine.ca/blog. And so at any point in time, if you have a question, can't hear us, want to give us some feedback, do send a message in the chat and we will make sure that we're monitoring the chat. And also, just so that you know, we are live on Facebook. So welcome everyone who's watching us on Facebook and interacting with us there. And we're also live on YouTube. So thanks so much, Rebecca. I'm going to pass it over to you. And yeah, I'm super excited for this talk. Okay, so we're gonna unmute. Yeah, go for it.
Okay, perfect. Thank you, Julie. Yes, I'm very happy to be here, and thank you for everybody who is taking the time out of their day to watch this webinar as well. So mental health is something that I am very passionate about, and yeah, so I'm looking forward to today as well. So, all right. So before we begin, just a quick disclosure, this webinar is intended for information purposes only. It doesn't take the place of individualized medical advice from a doctor, dietitian, or other medical care provider. I have no conflicts of interest and nor third-party endorsements. Okay, so today we'll be going through some of the statistics, so the numbers of mental health that is apparent today, as well as the basics of the brain-gut connection, which includes the microbiome. So a word that is kind of a hot topic today. I'll explain a bit more about what that even means. And then we'll be focusing more on depression and anxiety, since these are the mental health conditions that are the most prevalent in our society today. And so we'll be looking at some foods that have been shown to improve the symptoms of these conditions, as well as other considerations, which are maybe certain dietary patterns that sort of might hinder your progress in terms of the helping with these symptoms. So lastly, I'll go through some practical tips for actually beginning to design your diet for mental health, and then we'll have time for questions, answers. So like Julie said, if anybody has any questions throughout, feel free to put them in the chat, and then afterwards we'll have some time to kind of go through and hopefully just answer anything that might come up. So before I dive into it, I just want to clarify that designing your diet. So I don't necessarily I'm not really a dietitian, but in this context, it's more just a dietary pattern, meaning like looking at the overall like what you're eating throughout the day. It's nothing like a weight loss diet or anything like that. So just to make that very clear. Okay. So one of the common statistics that I'm sure all of you have come across with mental health is 1 in 5. So essentially 1 in 5 North Americans will experience a mental health challenge in any given year. This is before COVID, so I'm kind of guessing that this year it's going to be even higher than this. But lo and behold, it's about 20% of people at any given time in a year will be experiencing something. So that's a huge, huge percentage of people. As well, almost half, so 46% of people will meet a diagnosis criteria for a mental health condition within their lifetime. So this means that the symptoms that are being experienced are severe enough to actually fall under a diagnosis. So food does play a role in this. So it's been shown that having a balanced diet can lead to more of an increased mental health, mental well-being. And on the other side, mental health issues are linked to poor dietary factors. So this is kind of like a two-way street. So it's not necessarily that like whether you're having these challenges, you will then eat poorly because maybe these make it more difficult, or is it because we haven't been eating so well, so that makes us more prone to the mental health challenges. So it goes in a two-way street, and it's not always something that's easily divisible, but basically we know that food does have an impact. So part of that is the brain-gut connection. So this is something that is pretty hot in like research and online and everything, especially with the mental health. So I'll go through some of the basics of it. The reality is it's a really complicated system, and even in research, it's something that we are only beginning to kind of touch on because there's just so much, and research moves slowly, and we're just trying to figure out all of these little characters within it. So basically we have the enteric nervous system. So this is the nervous system that is in our gut. It has 100 to 500 million neurons, which are our nerve cells that send signals throughout our bodies. So this is the most neurons in any one part of our body, including our brain. So it has more nerves than our brain. And that's why it's been labeled as the second brain. So part of the system is the vagus nerve. So give me 1 second. Hopefully my face isn't covering on the side. But basically, if you see on the side, we have like a brain and then a link and then the stomach. So it's instead of a stomach, it's kind of like our entire intestinal, like entire digestive system. But think of the vagus nerve as being that arrow that's connecting the two. So it connects the brain with the gut, and it also wraps itself all around our digestive system. So it's all throughout it, getting different signals from our food. It also plays a role in food digestion. And we'll just send those signals to and from the brain to the gut. So very, very connected. The other parts of the nervous system that do play roles in the brain-gut connection include the central nervous system, so the CNS, which is the brain and the spinal cord. So that's kind of like the main thing we think of when we think of our nervous system. So it produces some hormones, including dopamine, serotonin, and acetylcholine, which play roles in mood regulation, our thoughts, and our emotions. We also have our autonomic nervous system, which has sympathetic and parasympathetic nervous systems, so within the two. And that's like involuntary and voluntary functions, so things that we have control of and things that we don't so much have our own control. Our body kind of does it on its own. So these are also regulate some hormones, so adrenaline and noradrenaline, which have functions in our food digestion as well as fight or flight response, so part of like the stress response. And then lastly, we have the HPA axis, which is the hypothalamus, the pituitary gland, and the adrenal gland. So these as well produce some hormones that stimulate the release of cortisol, which is kind of known as that stress hormone. Huge, huge role in the stress response, fight or flight. As well, our gut plays a large role in this too. So what happens when any of those systems, if something is disrupted, so whether it's a chemical or just anything happens? So basically, if there is an imbalance in the nervous system or any of the signals, it can affect the entire brain-gut connection. So this can cause things like mood changes, reduced immunity, hard concentration, difficulty concentrating, and compromise our gut barriers, which is basically like this protective coating that determines what from our food that we eat or what's in our digestive system can actually pass into our blood. So as soon as that's compromised, certain things can get into our circulatory system and kind of that aren't supposed to be there and wreak havoc in different areas that should not have those different molecules. So when we think of mental health, one thing that I want to make sure is really, really clear is that medication can be extremely, extremely useful in some cases. So this webinar does not by any means take away from the importance of medication if you find something that works for you. And it's not saying that you should just automatically switch to food or even ever. Like it's all about the individual. So yes, food and our gut bacteria play a role in mental health, but when we're talking about medications, you want to make sure that you are under the supervision of like a doctor, somebody who is trained. And even if you are thinking of, weaning off of it, it is something that you want to make sure you have that professional overlooking. So today we are going to be focusing on the food. So part of that is this microbiome. So essentially, the microbiome is a word for all of the living organisms, the microbes in our guts. And we have very, very, very diverse microbiomes. So a person can have up to 1,000 different kinds of bacteria, microorganisms in their gut alone. So we have good kinds and maybe not so good kinds. So ideally, the ones that are more on the healthy, good bacteria have a symbiotic relationship. So this basically means that the guts do things in our bodies that help us, and we in return do something that helps them. So for a bacteria, we give them a home by having them in our guts. And on the flip side, they might be doing something like helping with hormones or breaking down fibers that we can't. So it's sort of just a mutually beneficial relationship that is ideal. So different roles that they play in making hormones. So these hormones can affect our mental health as well as inflammation, including brain inflammation, which has a link to some of the mental health conditions. So ideally, these are kept in balance, and disruptions then can affect all different parts of our bodies. So as we looked at in the previous slides, just because everything is so interconnected, different disruptions can actually show up in other places. And that's also part of the reason why having more of a holistic look on mental health. So rather than just thinking about the thoughts alone or, those obvious symptoms, it's kind of thinking that everything in our lives is connected. So as soon as one thing is a little bit off, we don't know how that's going to affect everything else. So having this bigger picture, including our diets, can be a great way to sort of begin to move in a more of a healthy, for our well-being, like that kind of direction. Okay, so within the microbiome, the brain has a role. So it's a two-way street again, because everything's a bit connected. So for example, 2 hours of stress can change our gut bacteria. So just that short period of time can cause different mechanisms in our body to actually change the bacteria that is in our gut. Our brains are also can be in charge of changing the movement of our gut, so digestion and absorption, and it secretes certain things like acid and base, which is really important for our body's pH and our mucus, so the protective layer for the gut. And that kind of goes back to the compromising the barrier. Is as soon as like any of this goes, we don't know like what might be floating around our blood that shouldn't be there. So food obviously has a role as well. So it can influence the brain directly and indirectly. So our food can be broken down by the microbes. So as I was saying, like sometimes they break down fiber for us, and that's something that we actually can't ourselves break down. And the food also can influence the brain chemicals, just depending on what we eat and kind of what's going on down there. And it also affects the gut bacteria. So certain foods can promote or slow down the growth of good bacteria. And there is links between in the research for food and many mental health conditions. So these include anxiety, depression, PTSD, ADHD, dementia, OCD, insomnia, bipolar, schizophrenia, and libido. So lots of research is coming out in these areas. And I'm sure more will come out in the next couple of years, just because it is such an important topic and something that is now catching the interest of not only the research community, but the mainstream. So it's good. Okay, so as I said before, we're going to focus today more on the two that are the most prevalent in our society right now, which are depression and anxiety. So anxiety is the most common mental health disorder. It affects up to 1 in 3 adults, and often it goes undiagnosed or untreated. So because we kind of think of being anxious, it's almost just normalized. So a lot of the time we might be feeling these things and do not seek help for whatever reason. But the research even shows, though, that only about half, so I think it's 50 to 60% of people who go for treatment for therapy and medication alone don't actually respond to it as well as would be expected. So this could be where it might be really useful to look at our diets. So there's a lot of links between anxiety, so anxious feelings, and our guts. So if you think about like butterflies in your stomach or being nervous before a big presentation and like your insides just turn to liquid. So there's obviously some connection between the two. Gut bacteria can be reduced and is less diverse in sometimes with people with anxiety. And this also won't change without changing our food choices. So the changes in our guts, we actually need to feed the right bacteria to be able to really kind of have a positive effect on that. As well, IBS is very common in people with anxiety. So IBS stands for irritable bowel syndrome, which is basically a condition that affects our digestive system, and our bowel habits can be, bloating and gas. So it's something that's not comfortable to have, but because it's so prevalent in people with anxiety, it kind of just furthers the fact that there is likely a link between like our anxiety and our digestive system. Depression as well. So it can have huge effects on our appetites. So kind of both ends of the scale. It can lower our appetites. It's just if don't have any energy or motivation, or we're just really feeling low, it can be hard to get that like the want to actually eat anything. And then on the other side, it can also increase our appetite, comfort eating, going for those foods that just make you kind of, feel okay for a second. And part of this, it's always important to know that a lot of this has different mechanisms in our bodies that's beyond our control. So for example, when you're eating something like a comfort food, like something really sweet, and you just it might even make you feel guilty afterwards, or it's giving you like a spike of some of those good hormones, and you feel okay for a second, and then it goes away after a bit, and then you just want more. So it's there's a lot going on in our bodies beyond just our thoughts. So a lot of these cycles are beyond our control, and this is where having the help of somebody else can actually really kind of help you get a grasp on some of these things. So as well, just making healthy choices can be more challenging. Just again, the lack of motivation to actually make a meal might not be there. So those with depression, it's been found that it can change our microbiomes again. So it can lower some of those good bacterias and have higher levels of the not so good bacterias that can cause some of that inflammation. Okay, so we'll be looking at a few foods in detail and certain vitamins, minerals, something tryptophan, which again is another one of those words that is kind of out there, and as well as the Mediterranean dietary pattern. So all of these have had research shown that they can improve symptoms of depression and anxiety. Okay. So to begin, we have probiotics and fermented foods. So basically, probiotics is living bacteria that are good for our health that are actually found in foods. So you're eating these foods that already have the living bacteria in them, and they go into it. They get through our stomach, all that acid, and they can help our guts to repopulate certain strands that are seen to be beneficial. So